it's great as a host to be able to book somebody and know that despite the somewhat low fees involved, you know, that you can count on that person to be there, to be ready, to be full of really, really interesting and important information. So, which brings me to our topic tonight, the whole healthcare debate. I got to tell you, I've been depressed for the last month at the tone of this thing. I was pretty depressed before that because we kept hearing Obama and Obama supporters saying, well, we can't do the right thing about this or about this or about this because we're saving all of our focus to get healthcare through. Well, the healthcare thing has been ugly, ugly, ugly. People bringing guns to presidential forums, you know, posters with racist images, Nazi talk. It's despair is in the air. Abel, what do you think is going to happen?
Oh, you know, it looks like, unfortunately, it looks like the healthcare reform bill is being watered down to favor special interests that don't want change. I mean, obviously, the Republicans don't want change, and we're seeing conservative Democrats collaborate with drug and insurance corporations to weaken the bill to the point to where it's actually could be harmful and counterproductive. I mean, what we saw with the Wall Street bailouts, we saw, you know, hundreds of billions of dollars given to Wall Street, trillions actually if you include secretive bailouts. And we're seeing sort of a similar kind of path with the healthcare bill. We're seeing even the public option, it's either going to be non-existent or weakened to the point to where it's favorable to the insurance companies. I mean, they're trying to design the public option now. Conservative Democrats, Blue Dogs especially from Arkansas, are designing the public option to where it's required to cover the highest risk patients that might need the most expensive surgeries, to where it would make it uncompetitive with private insurance. So then they can say, well, look, public option didn't work. It didn't compete with private insurance, because these insurance companies do everything they can to not cover these patients that may face expensive surgeries through the process called rescission. And we've seen a congressional investigation found 3 insurers used rescission to cancel 20,000 policies in 5 years, and it saved the corporations $300 million. And they also used various other methods to try to drop coverage.
So let me get this straight. You mean they're going to let the private insurers off the hook as far as taking care of really needy patients?
Right.
And they're going to put all those people on the public option.
That's how they're trying to design.
That's the public option. They take care of the people that the insurance companies won't take care of.
Right. I think if a public option passed, it will be weakened to where it becomes uncompetitive, where it does not endanger the private insurance corporations' profits. Yeah. And we've seen, I mean, the private insurance profits, we've seen them go up.
Harper's.
The Harper's Index said that private insurance profits have went up almost 430% since 2002. And so that's just unbelievable. 430% increase in profits for these companies. And
percentage change in average premiums paid has gone up 87% in that time.
Right.
Percentage change in profits, 428%. Right. And here's another little tidbit. Chances that an American bankrupted by medical bills has health insurance.
They have health insurance.
Is 7 in 10.
Right.
And yet the debate has been run on this nonsense about pulling the plug on grandma and rationing of healthcare, as if we don't have rationing of healthcare.
Right. Yeah. The private insurance companies are rationing it. I mean, they can drop you if they want, and it's just wrong. And I think a lot of this misinformation is coming from Fox News and right-wing radio. I mean, they're confusing people and lying to people and misleading them and stimulating them to be angry and run into town halls and just scream stuff that's not helpful at all. It's not a civilized debate in any way. And it's really unfortunate. We're seeing these drug and insurance companies spend millions and millions of dollars television commercials that essentially lie to people and distract them from the truth. And
I have a problem with that I don't know might have some direction to go. It seems to me that when corporations lie about their products, they can be culpable, right? They can be sued. for lying about what the content of their cereal is. Well, if they're lying about the debate, the political debate, that's a product they're putting out there too, and they're lying about it. Right. Why can't they be held responsible for that?
I don't know.
The small, tiny piece of the mess, but
it's in a different legal category, I guess, and unfortunately, Americans don't pay attention to the real news enough to know whether these people are lying or not. So it's largely a function of the stupidity of the viewers and the listeners.
Corporations have the First Amendment protections. You can't easily sue for an advertisement, you see, and it's extremely.
No.
A lot of times,
in business matters, they're not allowed to say anything they want.
Right. Sometimes they
yes,
try to.
They are.
Yeah.
They virtually are, Claire. Let's see. Can you think of a case of a corporation?
Sued on false advertising?
Yeah.
Yeah. I mean, I don't.
Individual suits. This is covered under the Federal Communications Commission.
I can't cite you examples, but it seems to me
but
that's
not many.
That's a lot. that issue comes up a lot. That they're not allowed to false advertise. They can be sued for false advertising.
But by the government, yes, the FCC can sue them.
What I think is interesting about even not so much what we're seeing on television, but what we're not seeing. I mean, what we're not seeing is any discussion of the real answer to healthcare reform, which is single-payer healthcare.
Of course.
We're not seeing that. And we see some polls show that a majority of doctors and a majority of Americans do support single-payer healthcare. And we are not seeing that in the news media at all. And what we know is that $2.4 trillion right now is being spent on healthcare. And yet we fail to cover, 50 million and millions more underinsured. And it's estimated that a third of that 2.4 trillion is waste to private insurance bureaucracy that could be streamlined through single payer. And it would save America $400 billion, which would be enough to cover everyone. And the current bill that we have now is going to actually add $240 billion to the budget deficit, when we could actually be saving money and covering everyone with single-payer health care.
I'm afraid that not that many Americans believe in the single-payer plan or in the public option.
There's polls that range from 40 to 62%, I believe.
Well, I'd be interested to see those, but it seems to me Americans are awfully anti-government, and that's a lot of what's driving this.
I think it's a
and
minority.
That runs through our history, this fear and suspicion of government. There was an article written before the whole debate started called Why America Won't Get the Health Care Plan That It Needs. And it certainly looks like we're not going to get that plan. What we need is a single-payer plan. If we don't have that, we need a good, strong public option.
Right.
We're not likely to get either one, and I think it has a whole lot to do with Americans' fear of big government.
Well,
that's why the other countries are covered and Americans are not covered.
We see though that television advertising, these 30-second commercials that mislead people and distort the facts, we see that shifts public opinion. So we could have one poll that showed 50-something% of Americans support single payer one day, and then we have millions of dollars in drug company and insurance company advertising their commercials, and then all of a sudden public opinion shifts.
I'd sure like to see a serious, honest poll of that, because the whole reason that the Democrats gave for not being willing to put up a single-payer plan option, at least for discussion, they didn't even want to discuss it.
Obama did.
They said that this was because it just wouldn't go anyplace. It would be a complete non-starter. But if the polls show what you say, then it's not a non-starter.
I think Abel was right, and you were right too, except that he meant, that report meant that it would go nowhere in Congress, because the majority of the people want everyone to be covered.
Right.
If they want a Medicare for everybody.
Right. The public, I think,
but they think they can get that without the government so-called interfering in it. It's going to take a government plan to cover everybody. Right. That's the reason Europe has everybody covered and we don't.
Yeah, and it's just interesting how a lot of these protesters that town halls do have, are on Medicare, and they're like, we're against government health care.
Yeah.
There's been